Good morning, everyone. My name is Andy Bindman. I'm here from the University of California, San Francisco, and I'd like to invite up members of the first session. And I will briefly introduce you all, and then we can get started. I guess to pick up on the theme that Greg laid out for you this morning, I'm not going to be singing. I'm not even going to be humming, but I would say that if we are going to break some of our traditions with regard to evidence, that it would be important for us to hear from end users of evidence in different kinds of roles to tell us a little bit about their perspective of how evidence currently feeds into their way of life, and to also give us some insights about ways that the evidence process might work differently to allow their lives to work a little bit better. So you have in your packets very detailed information on the bios of all of the distinguished members of the panel. I'll just briefly tell you who they are, and we will, I think everyone's sitting in the right order. And what we're going to do is have the positions or perspectives, I should say, of a payer. And as a payer, we'll have Michael Sherman, who's the Senior Vice President and Chief Medical Officer of Harvard Pilgrim Healthcare. Then we'll hear from two delivery system perspectives. First, we'll hear about one at a very integrated model. We'll hear from Michael Horberg, who is the Executive Director, Research, Community Benefit, and Medicaid Strategy at Kaiser Permanente Mid-Atlantic Permanente Medical Group. And we'll also hear from, with regard to the delivery system perspective, from Daniel Ford, who's at an academic health center. He's the director of the Institute for Clinical and Translational Research at Johns Hopkins School of Medicine. And then we will hear from the patient perspective, and representing that will be Sharon Terry, who is the President and Chief Executive Officer of Genetic Alliance. Each of these speakers has been given up to 20 minutes with an opportunity to represent their perspectives. And then we'll hear from a couple of discussants giving us some perspectives on what they heard from these different points of view. And then finally, we will open up the questions to the panelists from all of you. I'll introduce the discussants after we have the presentation. So with that, let me turn it over to Michael.